over, but yeah.
I'll tell you, here's what I like about this. Halo's integrated with Cerner at this point, and there's also this labs feature, which are health challenges, experiments, and workouts designed to help users build healthier habits, such as improving sleep quality and finding more effective workouts. The beautiful thing about the Apple Watch and the beautiful thing about Apple is it is a walled garden. The awful thing about Apple is it is a walled garden. And I like this. It seems like they're putting in a little opportunity for you and I to create habits together, or a family to create habits together. I also like that this is not me too. It is going to have a lot of the same sensors and those kind of things, but it's interesting what they've done with voice and some other things. If I were CIO, I'm curious your take. If you were a CIO, are you still looking pretty closely at some of these devices?
I think I would probably think of this in the context of what's my long-term strategy around care at home and remote care and those kinds of things. Are there ways that this ties into giving us another piece of data that might be useful for our clinicians? So there's a lot of clinician collaboration that has to happen around this, I think, to really understand what's useful and what's interesting. Because you and I both know when you talk to clinicians about EHRs today, a lot of them continue to say that there's so much data that it's overwhelming and it doesn't give them the things that they really want, but it's hard to say what those are sometimes from patient to patient. More information out of context isn't necessarily better. I think it will take a lot of collaboration to really understand how these things are going to play into helping physicians or clinicians in general do their work more effectively. I think there'll be pockets of things they'll figure out, but that's how a lot of this stuff works. It's little experiments, things turn into a routine, that becomes something that everybody does, and then you continue to expand from there.
All right.